My name is Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California, and I want to welcome you to our webinar tonight. Again, the title of our webinar is Just My Type, 10 Questions You Should Ask When Choosing Your Health Insurance. I want to go ahead and give a quick introduction to the Hemophilia Council for those of you who may be new. We are a nonprofit organization which coordinates the shared advocacy agenda of the 4 California bleeding disorders organizations, and we coordinate statewide advocacy regarding access, education, and advocacy efforts on behalf of individuals living with bleeding disorders or rare and chronic conditions. So our mission really is to improve access to care and treatment options in order to advance the quality of life for people with bleeding disorders. And really, along with that, we do a lot of work with the rare disease community broadly as well, because so many of the issues that we work on for bleeding disorders patients affects many other rare disease patients as well. So now I'm going to turn it over to Mary. She's going to introduce herself and tell you a little bit about My Patient Rights, who's our partner for this presentation this evening.
Thanks, Lynn. I'm very excited to be here because I believe strongly in how important advocacy is, advocating for your own health. And that's exactly what My Patient Rights does. It is a website set up to help you, individuals, advocate for their own rights. So you can check out one of the pages such as advocating for care to learn about, what we hear most often, the questions we get, we've answered them there. You can also scroll down, click on your state, and it'll tell you how to file a complaint if you're not getting the kind of care that you need. You can send us a note, you can call and get more help too. So we're excited to be here and thrilled to share My Patient Rights with you. So kick it off, talking about the questions you need to ask when choosing a health plan. So what is your current insurance? So think about, where we are now and get an idea of where you want to go. So do you know what kind of insurance you have and who pays for it? So do you have a marketplace plan? Are you getting it through your employer? Have you used your coverage? And is it working? That's a big question, right? We all want it to work right. You don't want to have My Patient Rights, because it's going to be smooth sailing, we all hope. So have you asked for help when you needed it, and were they helpful? So it's critical that you feel important and satisfied by their responses. It's open enrollment, and we want to get you into the right place with the right plan. So on to the next question.
I just, real quick, Mary, also want to point out that, we'll touch on plans and options like Medi-Cal and CCS, but most of the questions and the suggestions that we're talking about tonight really relate to commercial health plans, right? So plans like plans through your employer or plans that you might get through Covered California would be examples of commercial health plans.
Exactly. So what has changed this year? And this is not just what has changed for you, but what has changed for your employer, because all of this affects what you're getting and what you need. So has your employer changed what they're offering? So they could change insurance companies. They could change the plan within the insurance company. Has the plan changed any of the benefits? So even if you have the same plan and your employer is offering it again this year, the actual benefits could change within it. And then finally, have your circumstances changed? So things like having a new baby in the family, did you change homes and you need providers in a new area, and are they covered? And maybe you started a new medication. It's good to check and see that those things are covered when you go into a new plan, or you're signing up again for the same plan. So, but where do you find out about that? And so it's because it's important to check your HR department. If you're getting your insurance through your employer, is a really good place to start. But now an HR is dealing with, everybody in company, so they might not know the answers to all of your questions. So the plan is always there to call. You can call them. You may need to document, well, you absolutely need to document anything they tell you. If you can get it in writing, that's even better. You could go to their website too. Often they have the plans and the details on the website. And Lynn's going to dig into that a little bit with you later too.
Yeah, one thought on that too is one of the tricks that I have found, because some of those plan documents can be super long,
Yeah.
right? They can be hundreds of pages and it's kind of overwhelming and you're like, I am not going to read through this whole thing and stay awake. So one thing that's great is now in this age, most of those documents are digital, right? They're on a computer. They often you can download them as a PDF, and then you can do like a search for or a find for certain words, right? So if there's certain terms, certain medications, certain types of medications, you can kind of make a list of those things that you're interested in and just try to search for variations of those terms. And then that might take you to the applicable pages in the document and help you find the information that you're looking for.
Right. And that's really critical because you do not want to print one of these. So downloading it and using it on a computer is the best move, I think. And this is critical for people who have treatments that might be specific or rare. You need to dig into that and make sure that your treatments remain covered. In addition, some of those treatments are pharmaceuticals, and covered under that benefit, but some of them are covered under the medical benefit. And that's unique circumstances, and you really need to dig in, make sure whatever you're on, whatever your treatment is, that's covered. So why don't you talk a little bit about the plans, Lynn?
Yeah, so this is a little bit more of kind of helping define some terms that you're going to see potentially as you look at plan offerings. And just a little like personal story. So my husband works for the state of California. So my family gets our health benefits through CalPERS, and CalPERS right now is actually in the middle of open enrollment. So I was working on this webinar earlier today and I was like, oh crud, I need to go look at the open enrollment documents and see when we have to make our decision and what's happening. And because it's a very large employer, it's the state of California, there are multiple options for us to look at. And some of them are HMOs and some of them are PPOs. And those are two really common options. And so what are the differences, right? So an HMO is a health maintenance organization. Typically in an HMO, you're going to have lower premiums, which is your monthly cost. And that might be paid at least in part by the employer if it's an employer plan. And often they will have lower out-of-pocket costs, but your network of providers, and the provider means the doctor, the hospital, the physical therapist, can be narrower or more limited, where you have to go to a provider that's in their network. And so your provider may or may not be in the network of that HMO, and that's really an important consideration when you're looking at those plans. PPOs, on the other hand, are preferred provider organizations, and their costs can sometimes be higher. Sometimes the cost sharing is higher, like the copay or the coinsurance, and we're going to define those terms in a little bit, but that often allow you more flexibility in choosing your providers. And then not necessarily quite as common, but there's also point of service plans, which are similar to a PPO, but require referrals, and your PCP, which is your primary care, coordinates that care. And there's also high deductible health plans. And in a high deductible health plan, the premiums are much, much lower, but often you have to pay thousands of dollars out of your own pocket before the health insurance kicks in. So I would say that in general, high deductible plans are usually not a good option for patients that have, kind of complex or chronic or rare medical conditions where you have lots of medications and costs, right? Those kind of high deductible plans are probably not going to be a good idea. So expanding a little bit on what we talked about there with networks, a really critical question to ask is, are the doctors and hospitals that I want to see, are they covered on this plan? Right? So the type of plan will determine the network of providers that you're allowed to see. Sometimes it's a matter of, hey, if they are not in the network, then the insurance isn't going to cover it at all. Sometimes it is like, this is true a lot of times of PPOs. Sometimes they'll still cover it, but you have to pay more of the cost if they are going to cover a portion of it. And this is particularly important for our bleeding disorders patients and your hemophilia treatment centers, right? Your hemophilia treatment centers are not necessarily in every network. And so if you're currently seeing a current provider, and you are looking at a health plan and potentially a change in health plan, you really want to make sure that your provider is part of that network. And I would really suggest that you check this in two ways. First, you check with the health plan to ensure that the health plan says, yes, that provider is in network. And usually even most health plans have a spot on their website where you can go and you can look up providers and make sure that they're on the list. But you can also call the doctor's office and check and say, hey, this is the new insurance that I have, or that I'm looking at getting. Do you take this insurance? And I will give one additional caveat with that. Sometimes even within an insurance, there are sort of like sub plans. And so you can't just give them the name. You might need to have the plan number or the provider group. So, for example, my family has a Western Health Advantage as our insurance, and our provider group is Hills Physicians. So when I call to check, we just had this happen. Our pediatrician retired, and so we're in the process of finding a new doctor. And when I'm looking at doctors' offices, I'm calling them and checking, hey, do you accept Western Health Advantage, Hills Physicians Group, and are you taking new patients in our case? Now, if you're a continuing patient, most times the provider will continue to take you as long as they are in that medical group.
I just ran into something similar for myself, and I needed a new physician and got a list directly from the health plan, called them and asked them to email it to me, and started going through that list and calling the doctor's offices to see, if they were available. And I'd say, I don't want to guess the high percentage that were not available, but it was a very high percentage. So making that phone call before you try and hook them up is really important.
Exactly, because sometimes even though they're on the health plan list, they may not be taking new patients for that particular health plan. So it's always good to double check. Moving on to a related but very, very important question, right, are the medications for me and my family covered, and how much are they going to cost? And Mary alluded to this earlier, and there's some very important caveats that we need to talk about for those patients that are on specialty medications. So this affects our bleeding disorders patients quite commonly, but it's not just bleeding disorders patients. A lot of new medications today are, various types of biologics, sort of non-traditional, not necessarily pills. And oftentimes any of these specialty medications, excuse me, will be covered not under the pharmacy benefit, but under the medical benefit. So think about the medications that you take. It would be good in this process to have a list of them. And you could potentially even talk to your pharmacist office about, they could help you understand, hey, is this a name brand drug? Is this a generic drug? Because one of the things that you'll often see on the pharmacy benefit is that name brand drugs often have a higher copay than a generic drug. And then, like I said, sometimes those specialty medications like blood factor will be covered under the medical benefit and not under the pharmacy benefit. We had a very difficult situation with a patient who contacted us probably about 6 months ago. He transferred off of his parents' insurance when he turned 26 and got a marketplace plan. He investigated, or he thought he investigated, and he had seen that the plan he selected had $0 copay for prescriptions. So no copay for prescriptions. So he assumed that that meant that he could get his blood factor and that he wouldn't have any cost for it, that there would be no copay for his medication. And then he got his first order of medication and he received a bill for over $5,000 because the specialty medicine that he was on under that plan had a 20% coinsurance. So he was having to pay 20% of the cost of his medicine. And so, you know, that's definitely something that you really want to look at very closely and probably call and ask them very specific questions. Ask them to point you to the right place in the plan documents to look at it so that you have it in writing. So I do know that I have a question in the chat, so I will get back to that in just a minute. But so what are your total costs going to be, right? So one of the things that you need to think about when you're looking at your insurance is the fact that some of your costs you may have to pay right up front, and some of your costs are going to pay as you use your healthcare or as you receive healthcare. So a lot of times we just look at the premium costs, right? Like how much is the premium going to cost me per month? The premium is what you pay to the health insurance company in order to have that insurance, right? And you have to pay that whether you use the health insurance that month or not. Because if you don't pay every month, they're going to cancel your coverage. If it's employer insurance, oftentimes your employer pays a portion of that cost, and then they might deduct a portion of it out of your paycheck, for example, in order to pay the difference. So sometimes it's partially the employer. Sometimes if you're really lucky, maybe it'll be entirely your employer. But more common, you pay a part of it, of that premium. And then, so sometimes if you have a lower premium, it often means that you have a higher cost when you go and actually use the services. So you also have to look at the deductible, which is how much you're going to have to pay before your coverage fully kicks in, and then you're also going to have to think about what either the copay or the coinsurance is. So an example of coinsurance is what I had just talked about, where you have to pay a percentage of the total cost of service. So in the case of that one young man, it was 20% for his medicine until he hits his max out of pocket. It could be 30% for an ER visit, for example. The copay is when it's just a set dollar amount based on the service that you're being provided. So like $15 for a doctor's office visit or $50 to go to the ER. And prescriptions are often copays like that, where it's, you know, $15 for a generic and $30 for a name brand product each time you get the prescription, for example. Okay. Another important question that relates to that pharmacy issue is the copay accumulator adjuster. And this is a super complicated issue that we don't have time to go completely into tonight. We have like an entire webinar on this. So if you have more questions on this, feel free to shoot me an email and we'll get you connected to the entire webinar. But an accumulator is a fancy word that's used to confuse you and try to make it sound like they're doing something good. But really what it is it says that if any patient assistance that you might receive from, for example, the pharmaceutical manufacturer will sometimes provide patient assistance to help with those large copays, like that young man who was going to have to pay $5,000 to get his medicine, might be able to use patient assistance to cover that cost. but they say that they're not going to count that towards your deductible or your max out of pocket. So what happens is your assistance runs out after you hit the limit, and then you're still required to pay at, that large amount out of pocket, which you couldn't pay in the first place. So that's one thing that you want to check the plan. And we've got some terms in this slide. Sometimes they call it other things like true accumulation or, patient assisted card solutions. Not a solution, obviously. It's actually a big problem. So you want to look out for those accumulators. Okay, and then real briefly, in California, specifically, with certain conditions, and certain income levels, you do want to consider, do you qualify for other services that would provide better coverage, excuse me, and or lower cost to you. So Medi-Cal is income-based. California Children's Services is for kids up to the age of 21 with certain conditions. And it can be used in conjunction with private insurance. So you could have private insurance and have CCS if you have a qualifying condition and you're under 21. And that might operate as like your secondary to pick up things that your primary insurance doesn't cover. And then the genetically handicapped persons program has a specific group of conditions that it covers, which includes bleeding disorders, sickle cell, and cystic fibrosis. And with that, you could have just GHPP, either at no cost to you or at a low cost of an annual enrollment fee, and it could provide all of your coverage. In some cases, that could be better coverage than what your employer offers. So if you have a qualifying condition, it's always good to be aware of those and kind of look at your options. And again, we have a number of resources that we've done, other webinars and resources on Medi-Cal and CCS and GHPP. So, if that's a question that you have, you can reach out and we can get you more information about those programs and refer you to some of those other resources. And lastly, I kind of mentioned this, just some quick special circumstances to be aware of. You can at times have more than one insurance, right? So just keep in mind that if you have two health plans, there's always going to be a primary and a secondary. And depends on the rules of each plan, how much of the additional cost the secondary insurance might pick up. It doesn't always mean that it will cover copays and things like that, for example. And if you have, for example, like private insurance, and then you have, say, CCS or GHPP, those are always going to be the payer of last resort, which means that your private insurance is going to be billed first. And then if the guidelines of the program allows additional coverage, it will pick up things that maybe your private insurance refused to cover. And then lastly, COBRA is for people who lose their employer insurance. There is a law in place that allows you to continue that coverage for various time periods. It's not a uniform time period depending on a variety of circumstances, but your HR department, if you were to separate from your job and leave your job, they should provide you, they're required by law to provide you information about COBRA. It can be very expensive because you have to pay for the entire premium yourself, but it would help you avoid a gap in coverage. So it's just something to be aware of if you ever find yourself in that circumstance. Hi. Mary, I'm going to toss it back over to you.
Okay. So after you've done all this, where can you go for more help or just while you're in this process? So your Hemophilia Treatment Center or other providers, healthcare navigators, the Hemophilia Council of California, and then myrights.org. Please go visit. And then we've got coworkers, friends, and families in big letters here. It's because we've all done this, right? You say, who's your doctor? Which insurance company are you going with? And referrals are fabulous, but you always have to keep in mind that those referrals are coming from people who have different needs, different healthcare requirements, different family mixes. And so you need to really dig in and figure out which ones work best for you and your circumstances. And I want to just draw some more attention to mypatientrights.org, because in 2017, the California Chronic Care Coalition did a report on health plan decisions being overturned in California when they were when patient asked for patient reviews. They were overturned 60% of the time. So when you go and complain to your health plan, when you then go and complain to the state, file formal complaints, 60% of the time they say, no, insurance company, please pay for that. So it's really important that you advocate for yourself all the way through to the state so that you can get what you need. So I just want to make sure My Patient Rights is on your mind. And then the other thing is stories, patient stories. My Patient Rights gathers patient stories, because it's another way you help improve the system and advocate not only for yourself, but for other people. Because if you can talk about what your struggles have been, where the system has failed for you, and we can share that with people who actually can change the laws or act to make sure somebody covers something if they find out there's a problem, then that's such a huge benefit that we're doing for everybody, that you're doing for everyone. So please consider sharing stories, and you can go to My Patient Rights and do that. And finally, complaints are how the state of California tracks what's going on with health plans and health coverage. So if nobody complains, they don't know. So I want to encourage you to advocate for your health on an ongoing basis. And then we have a few more resources. Oh, I jumped slides.
That's okay. We kind of covered this already, right?
Yeah.
But
Yeah, this
which
is
is
my
totally
slide.
fine. So these are a lot of, sort of the same things, additional resources, and talking about My Patient Rights, and the No Surprises Act is a CMS website. So I know we're getting to time. We have a few more resources on the slide, and do have a couple of questions. So Liz and Suzanne, I'm going to get to your questions, so hang in there, okay, for a few more minutes. So I'm just going to quickly cover a couple of things, and then we'll come back and stay on however long we need to answer any remaining questions if folks want to unmute and ask questions. But we do have 2 more webinars coming up, also on the insurance related topics before the end of the year. So next month in October, we're going to particularly be talking to young adults, and we have some young adults from our bleeding disorders community that are going to be on this webinar with us, talking about the transitions that you have to make in your 20s and how to kind of navigate those regarding your health insurance. And then in November, we're going to focus a little bit more on the public pay programs and options that you have through Medi-Cal, GHPP, and Medicare. So those topics are coming up, so watch for more information. Again, we want to thank our sponsors. I'm going to leave this slide up because it does have my contact information. If you want to get in touch with Mary, she can throw that information in the chat to get in touch with her. And then you can also always reach out to me, and I can help connect you to My Patient Rights if you need help. But we did have a couple of questions, so I'm going to start with the first one. So it's a little bit of a tricky question. It relates to the fact that the patient has an HMO plan and they are approved at a local HTC, but they're currently being seen at another HTC because that HTC is managing the clinical trial that they're on. So it asked the question about potentially getting GHPP or CCS. That is a possibility depending on the age of the person that's receiving services. I'm gonna suggest, because it's a very specific question, that if you want to email me, we can set up a time to talk that through, because there's a lot of specifics about your specific circumstances. In general, though, I want to add that if you are receiving treatment at a specific location because of a clinical trial, the clinical trial really should be covering the cost of that. So you really shouldn't be having things out of pocket. So want to dig in a little bit more on that. And then there was another great question about secondary insurance, asking, are there regulations that specify who is the primary and secondary or coverage requirements for insurance companies when you have more than one? Great question. So the answer that I found, and I would follow up on this if you are in that circumstance, but if both of them are private or commercial insurances, so if it's an adult and it's like, say you have a plan and your spouse has a plan and you're on both, your own insurance is always the primary and your spouse's would be the secondary. Okay. If it is a child, say, and mom and dad both have them on the plan, it goes based on the parent's birthday. So the parent who has the birthday earlier in the year is the primary, and the one that's later in the year is the secondary. And if it's an older child that's say, 23 and they have their own job and they've gotten insurance or they've gotten a marketplace plan, but they're still on their parents as well, their personal plan would be the primary and then their parents would be the secondary. Now, I would add, and I mentioned this before, if it is a commercial insurance plan and then some kind of state plan like Medi-Cal or more likely CCS or GHPP, then the commercial private plan is always the first payer and the state funded plan is the payer of last resort or the second or final plan. Great question about having a child out of network due to college, and that can be really tricky, right? We have a lot of kids in California, for example, that are on CCS, and then they go out of state for school, for example, and it can be difficult to have coverage. So it's really going to depend on the plan, and that is where you're going to want to look at the networks and what the costs out of network are. Oftentimes, there are exemptions for emergency type situations, and you can try to do your regular sort of maintenance, kind of go in, check in with the doctor annually, that kind of stuff, maybe when they're home from school so that they are in network. But it can be very tricky to get emergency, non-emergency care away from home. And again, this probably depends on whether or not the child is the person in the family with the, sort of the rare or chronic condition, or whether it's, someone else in the family and then, the child is relatively healthy. There's also, sometimes coverage that you can get as a student away at college, right? That's through the university or go to the university health center, that kind of thing. Those are probably not ideal though if you have a bleeding disorder, right? So that's not going to be who you want to see.
But on occasion, some of those college, university health centers will also take your insurance from home. But again, you have to check all of this out to make sure of the details.
Exactly. There was a hand raised if you want to go ahead and ask your follow-up question.
Hi, Lynn. It's Rebecca Buckmiller.
Oh, hey, Rebecca.
And hi. And that was my question. And I just want to thank the council once again for helping my son get his factor from Kaiser when he was way out of network. And so far that's been going pretty well, thanks to the thanks to the council and the advocacy piece. What hasn't been going so well is he lives there full time now and still obviously has a few years left in school, is the ongoing care. He doesn't come home much. And he did have another health issue where he went to emergency and then he was quickly stabilized and referred to his primary care physician, which with Kaiser was 4 hours away. So I'm looking to switch to another plan like a Blue Shield, Blue Cross, something else that he could he be set up with a primary where he lives if I'm holding the insurance here and the rest of the family's in this area?
Yeah, I mean, as long as I don't see why he wouldn't be able to do that as long as it was in network, right? I mean, you're sort of lucky, quote unquote, in that circumstance because at least he's still in state. I think it gets even trickier when the student is out of state because the networks are typically state networks. And not, there aren't people out of the state. But yeah, I don't see why he couldn't have a different PCP assigned to him that is in his area as long as the plan that you're looking at has providers in that region, right? So that's where you'd really you have to investigate. And I know that's, CalPERS too for you guys probably. So
Right.
you'd have to investigate the specifics of that plan and whether or not they have which plans have providers in that region.
Right. That's my plan. And I hear they're very impacted and long waiting lists for medical care as well. So just something I'm considering. Thank you for that. That's
Yeah,
helpful to know. It might be an option.
yeah, good luck with that. Let me know. You know how to get me if you want to follow up. So
Yeah, sure. I'll let you know how it ends up so we can share with other families.
definitely. Okay, I want to see here. There was also a question regarding the max amount to be able to get on Medi-Cal. That's actually a little bit more confusing of a question than one would expect. It's not a specific dollar amount because it also depends on the size of your family and a number of other factors. So if you think that that might be an option for your family, I would strongly urge you to consider going ahead and doing the application process. And the other reason I would say that is because the state of California has a process that's called sort of one entry point. And so you fill out one application and then it would let you know, yes, you qualify for Medi-Cal. No, you don't qualify for Medi-Cal. But then it will also, if you don't qualify for Medi-Cal, it will also let you know which covered California plans you may qualify for and how much they would cost, because you may qualify for subsidies that would make the cost of that insurance lower than you would expect. Right. So you can sometimes get covered California plans for very cheap, very, very inexpensively. If you're like maybe you make just a little bit too much for Medi-Cal, but you can get then that covered California plan with relatively little expense. Mary, did you have something to add to that?
Yeah, just I think that if you have children too, sometimes the children themselves will qualify for Medi-Cal when you don't, and you then would go on to one of the covered California plans. So that also lessens the amount of funds that you have to put towards that plan for yourself.
Okay, so then there's also there's also a question about GHPP. If GHPP is the secondary, how would they know whether or not to cover the rest? So generally that would be the provider that would be working on that with the with GHPP. So the provider, if GHPP is the secondary, or anytime that there's really a secondary insurance, right? The provider you need to provide both insurance cards or all the insurance information to the provider. And typically what they're going to do is they're going to bill the primary first, see what they get back. And then they're supposed to bill the secondary before they reach out to the patient, right? So really, if you do get a bill from a provider in that kind of a situation, it's always a good practice before you pay it to call them up and just double check that they did their due diligence and that they did submit it through both of the insurances that you have. You'd be amazed how many times people just don't ask the question. It's kind of like Mary was saying with the appeal. Like, a lot of times they throw up those roadblocks because people just won't even follow up and ask, right? And so it's always good to ask the question.
Right. I do it now for every bill unless it's a copay. It's on my card and it tells me I owe this much. If I get a bill from insurance from a doctor or the medical plan, I always call first and find out for sure what that is and why I'm paying it.
Exactly. It's a lot harder to get your money back once you've paid it to them. So it's always good to ask up front before you before you pay the bill. It cannot hurt. I know it can be a pain to have to make those calls and find the time and the opportunity to get through to the billing department, but it should be worth your time and effort. So I think that we covered all of the questions that popped up. Thank you so much for your time and your attention. I know we ran over in discussing some of those questions, but we really hope that this information has been helpful. And we hope that you'll join us next month, particularly if there is a young person in your life. Encourage them to come and join us for that one. And hope you have a great evening. Thanks so much for being here.
Thank you, everyone.